Hello, I'm Louise Gittins. I'm leader of Cheshire West and Chester Council.
Hi, I'm Alison Lee. I'm Managing Director of the Cheshire West Integrated Care Partnership.
Hi, I'm Ian Ashworth, Director of Public Health here in Cheshire West and Chester.
Thank you so much for taking time to join us and for your interest in our Community Champions initiative. The way that the community has come together over the last 6 months has been absolutely amazing, and we've seen so many people volunteering, whether it's been through our own scheme, through the Cheshire West Voluntary Action, through the NHS, through local mutual aid groups, Facebook groups, WhatsApp groups, and people being good neighbours. And what we want to do now is to build on that initiative and really go into the next phase. The virus hasn't gone away, and what we need you to do is take out those vital messages that we're so used to at this stage. Things around social distancing, washing hands, wearing masks in public places, on transport, and really importantly, reporting symptoms. So I'll get back to that later, and now I'd like to hand you over to Alison Lee.
Thanks, Louise. I'm really delighted that the NHS involved in this great initiative. I thought it might be helpful just to set the scene, to tell you where we've been with COVID and where we are now. This will help us all see that we're not quite out of the woods just yet. We all need to be aware of and alert to the threat of COVID-19. So in terms of where we've been, firstly, we've had an absolutely amazing response from residents, from the community, from the council and from NHS colleagues. But there has been a significant impact felt by people and businesses across the borough. So in terms of a few facts and figures, as of the 18th of August, we've had 2,096 cases of COVID-19 in Cheshire West. And very sadly, 400 people have died. We've seen outbreaks in 58 of our care homes. The majority of cases so far have been in adults of working age, and death rates have been highest in older age groups. In terms of the most up-to-date position, in the last 2 weeks, there have been 45 cases of COVID-19, and cases are increasing in the younger population. The most up-to-date information we have is our infection rate is currently at 5 cases per 100,000 people. This is significantly lower than many other areas in the northwest of the country. So thanks for listening. I'm going to hand over to Ian now. Thank you.
Thank you, Alison. I would just like to outline where we're going to need your help with 3 quick scenarios. Currently, cases are low in Cheshire West and Chester, which I'm really thankful of because of everybody's hard work and keeping it that way. But until we get a vaccine, we can't get complacent. So at the moment, I just need your help to make sure that we remind your friends, your family, your work colleagues about the importance of keeping 2 meters distance from each other, wearing face coverings in public spaces, indoor particularly. Also making sure that you continue to wash your hands, which is really important. And also, if you do get any new signs and symptoms of COVID, they are a fever or a loss of taste or smell or a new continuous cough, that you get a free test and you self-isolate and follow the guidance. Another scenario where we're going to need your help with is if a certain area of Cheshire West and Chester sees a rise in cases. We might need to do some additional messages through yourselves to make sure people are warned and informed about who are living there, working there, travelling there, visiting there. That might involve us having to suggest that don't visit other people's homes. It might involve us having to restrict visiting to care homes, all of which we don't want to do, but it's really important that we can do that through yourselves and get those messages that are clear out there. The third one is if we unfortunately see a situation where we've seen in other areas of the northwest where cases get to a certain level, we might need to introduce additional precautions. They might be involved closing down certain businesses. It might involve introducing shielding again. And it's really vital that we get your support and your help in getting those clear messages out, and also hearing back from you where we can help and support in a better way. I'm going to pass over now to Louise, who'll be able to give you a bit more detail about the role. Thank you.
Thank you, Ian. So the role of the community champions, we see this as twofold. The first one is about cascading information, and that's information that we will be sending out to you, but also information that you can send up to us as well. And the first part, in terms of the information that we'll be sending you, and Ian has already touched on this, this will be information and messages that we want you to get out to your networks. And you can communicate those in any way that you want to. So it could be through a poster or putting posters up in your community. It could be through WhatsApp messages. It could be on your Facebook page. So lots and lots of different messages. It could be around where people can go and get a test if they've got COVID symptoms. It could be reinforcing messages around wearing masks. And the other really important information that we need as a council, and this is where you can help us with that, is in your communities, ensuring that businesses are adhering to the COVID-19 measures and guidance that is given to them. So it could be something around social distancing in cafes or bars and restaurants. It could be around making sure that customers' details are being taken. But it's not just areas where the guidance hasn't been followed. It's also good practice as well. So if you see businesses that have gone over and above what they should be doing and have really redesigned their spaces to make them COVID compliant, we want to know about that so that we can share that good practice. So your role is going to be so important, and I'd really like to thank those that have been working so hard and volunteering and supporting their communities since March, and those new people that have come on board as we continue the fight against COVID-19. Thank you so much.